Good afternoon. Welcome, everybody. Welcome today to this session where we're going to have adult patients answering questions from physicians. And I'm going to introduce myself. My name is Biba Tinga. I'm here. I'm joining from Canada, and I'm here to represent GASDO, the Global Organization for Sickle Cell Disease. So we have one of our panelists here. So I'm going to be co-moderating with Sarvana these sessions. And we have Miss Cassandra Trumnell here. And then here, Cassandra, they can see you. Can we go straight to the questions and start?
Hello, everyone. My name is Cassandra Trumnell. I am an adult living with sickle cell disease. I live with type SS. I am representing two organizations today. GASDO is the first one, which is the Global Alliance for Sickle Cell Disease Organizations, where I sit on the board alongside Miss Biba Tinga. And I also am executive director at Sickle Cell 101, which is a nonprofit organization that specializes in sickle cell education. So that's just a little bit about me. Feel free to, I'm an open book, feel free to ask me any questions.
Great. Thank you, Cassandra. So we're gonna go to the first question. Okay, I'm gonna ask you right away, has somebody living with sickle cell disease? So when you are in a painful crisis, what do you want your doctor to ask you?
I'll just do a blanket like disclosure. I'm in the US. Things are a lot different in the US. Some of the problems that I experience may not be problems elsewhere. So I just want to put that out there. I want a doctor to ask me what to do. I've had experience with both doctors that say, oh, I know how to treat sickle cell patients, do this, and come out with a really bad result. But I've been living with sickle cell disease for 33 years. I think I'm 33. So I know how to, I know what medications work best for me. I know, how much IV, I'm an expert at me and an expert at being a patient. So if I don't, need an opioid or a narcotic, and I think, can be relieved with something else, I just want a doctor to follow my lead and just take what I say to heart. I think the doctors that from my experience, the doctors that know the least and just simply ask, what do? I usually hop out of the hospital at a faster pace. Like it's just, I'm in and out.
Oh,
It's doctors that where, I'm going back and forth and they're telling me I don't need a transfusion. I'm telling them I do, that's when I have the longer hospital stays. So that's what I would like a doctor to know. Like if I'm in a crisis, just ask me what to do and I will walk you through it.
thank you. Can I go to the next question, Sarbana? Can I continue? Well, it's good because Cassandra, now the next question I'm going to ask you is kind of linked to this one. So let's talk about, these new therapies. So what feature in any given new therapy will make you as a patient, agree to adopt it? Yes, you said that, so you want the physician to ask you, what to do. Now, if he comes and presents you, okay, we have new drugs, what will be the feature that will make you adopt it?
And one more thing, sorry, Biba. I think this is we might ask other people as well, Cassandra, if you agree.
Yeah, sure.
If anyone wants to volunteer to answer that question. So what would be the features of a new treatment that would, what are the good things and bad things that the risks that you might be willing to take, etc. for new, so that we get a variety of, responses from people.
Perfect. So then in that case, we'll let Cassandra answer first. If somebody wants to answer, if you can raise your hand so that we see and we can let you speak. Thank you.
Well, I will just let you know, I am on a new therapy. And the way that conversation went was actually me requesting for that therapy, not my doctor telling me about it. So this was something that I had been following this therapy for a long time. So I knew the benefits, I knew the risks, it seemed safe. I think my first consideration is, people talk about risks and benefits, risks first for me, and then benefits. And so I look at the risk, what do I have to lose? And consider that, and then, make a decision. And so that's a short answer to that question, but I definitely want to hear other people share their opinions on this.
Perfect. Thank you, Cassandra. Anybody who wants to?
I think Sola's just volunteered.
Hi, everyone. Hi.
Hi.
My name is Sola, and I'm someone living with sickle cell in the UK. I think for me, when it comes to new therapies, it's usually, again, weighing the quality of life it'll give me or what it'll take away from me versus, what I'll be getting from the medication. I've recently only, started hydroxycarbamide, and for a long time, I was not quite sure about it. What, was it worth it? I'd read all about the, the side effects and what it could do, and I wasn't quite sure if it was a thing for me. So it took me a long time to percolate and just let's think, okay, at the point I am in my life as well, would it be a good thing to go for? So at the time when I started thinking about hydroxycarbamide, I was thinking about increasing the size of my family. I wanted to have a second child. So obviously knowing that hydroxycarbamide could have detrimental effects to fetal development, I decided to hold off on it while I tried to have a baby. And then I followed on. After having my baby, I had to breastfeed for a while. And then it was only after that I thought, okay, now there's no time now, better than now to start hydroxycarbamide, because with continuing sickle cell crisis, probably my organs are never going to be better than they are at the present time. And so I thought, okay, now it was worth the risk of taking. And at the time I did worry about fatigue, about infections and all that, but I thought, give it a try. There was, it wasn't high stakes. It was whether it would work well for me. And if it didn't, then I could stop it. It wasn't, anything permanent. So I did give it a try, and I'm happy to report that so far, the side effects have been minimal, and I'm glad I tried it. But when it comes to like more medication or curative therapies coming forward, I think it would really be a balance between what it could add on to me versus what it could take away from me. So when it comes to things like bone marrow transplants and, all those other types of things, it'd be how invasive they could be, how many years of, preparation or even, getting better afterwards it would require, and vis-a-vis what my life is with 2 children, a husband, a career, and things like that, I would be considering in future, and what long-term benefits it could have for me.
So, well, it's we are really happy to hear, how you, what you want them to ask you when you are in pain, and then also then we talk about what future will make you adopt a medication. Now, the next question will be, how do you want your medical team to speak to you about available treatment? How can your medical team find better ways of giving you the information you need, in the format that, you want that you will receive better? How do you want it to be presented to you? So we can start again with any of you. Cassandra, do you want to go first?
Yeah, sure. I'm happy to go. I like conversations. I like honest conversations. I like being able to ask all the questions I want to ask right then and there, no time limits. But I also don't just want to talk to the doctor. I want to talk to somebody else that is on the therapy. So I want somebody that's exactly like me, going through exactly what I'm going through, which, someone living with sickle cell disease. And I want to ask them what it's like being on that therapy. And I think that right there is probably the more powerful than talking to a doctor for me. So I just want to make sure that I'm talking to as many people as possible that are living with the disease, that are actually taking that therapy.
Mm-hmm.
Thank you. There's just a couple of points here on the chat. I think Miriam volunteered to answer a previous question that Biba had put to the audience, which was to do with what would you like your doctor to ask you when you are admitted to hospital?
Okay.
Miriam, do you think you might be able to put that answer across to the audience now?
Yep. Hello. It's just adding to what was said before. I totally agree. It's based on my previous experience, especially with hospital admission, more than any other. So I have always worked, so I have always been able to balance work and sickle cell. But during my working life, of course, I had many hospital admissions and many painful crises and anything. And one thing that would add to anxiety a lot during hospital admission is you have no idea how long it's going to take. Meaning that, of course, that it's a wild card and it depends on how the crisis progresses. But I was never asked, what do you do? And do you have to provide any type of justification to your employees or anything like that? So it would have to be me bringing that up. And then like a big question mark in the face of the clinical team. Oh, but you work and you need to know when you will be back. And I would say, at least I need to know if the expectation is that I will be away for a couple of days or for a week or for more, because, well, I have deadlines and commitments and I have to say something about that. So there is a personal life, of course, and that should be taken into account in order to be able to manage the anxiety and whatever you need to do, so that you are a bit more, okay, I know that I'm in for some time, but in order to say I need someone to take over, I need to say it's, well, the forecast is this or that. So that's what I wanted to add. Thank you.
Thank you. I saw that Cindy, I'm sorry, my apologies, I couldn't see the chat. I'm looking now. Cindy made a good statement here, and I'm glad that like you are a partner, right, of somebody living with sickle cell disease. And these are very important individuals in the life of our adult living with sickle cell disease, because now more and over, you know, they have partners and they have a family. And those people play a key role. When you move from the caregiver, then you have a partner. I would like to hear your perspective on this. Do you want to say something?
Yeah, sure. Yeah. Let me present myself. I'm Cindy. I'm from Paris, and I'm part of an association which named Sickle Link. I know the sickle cell since 25 years, and I know exactly what to do. I know exactly what my husband needs when he's in pain. And usually when you arrive at the hospital, they just take care of the patient and they never ask me if he had something, a drug or everything. And when it's painful, it just need treatment, and you don't want to answer question. So I always ask if I can go with him and help the care team with all these questions.
Yeah, thank you. And yes, I agree totally with you. Thank you. Because what I've realized myself as a caregiver of an adult, once they become adult, they get to the hospital, the physician says, he's an adult, he can speak for himself. They don't even look at either the parent or like the spouse in your case. And sometimes they are so much in pain or they're tired or something is going on that they will appreciate that help, because you have been right there and you know what they've been through, how long they've been in crisis, what they took before coming, you know. But it's very important that the physician listen to the caregivers and the partners who are coming with these patients. Okay, thank you.
There are a few more questions. If we still have time after we've gone through the first lot, we will go back and ask you some more questions, if we may. So the next question in our list to ask everyone is, to ask the panel is, so there's some doctors who've said that they produce patient information, and they want to know if people with sickle cell disease is the right term, or patients with sickle cell disease is the right term. Would you like, do you have any views on being called a person or a patient?
Yeah, no, I think everybody, and I'm seeing in the chat here, person, I'm only a patient when I'm in the clinical setting. I'm a person outside of that. So always a person living with sickle cell disease. Yeah.
Great.
Somebody said it does not matter to them. Which is fair enough. The other thing I had a question is does anyone use the word sickle? I know that obviously everyone speaks a different language, and sickle cell disease is obviously only for the English-speaking countries, but for the English-speaking countries, is sickle cell disease something that you prefer, or sickle cell disorder?
I just say sickle cell. I don't say sickle cell disease. Yeah. I don't say sickle cell disorder. I just say sickle cell.
I think for me, if it comes down to it, I'd rather say disorder than disease, because it is a blood disorder and it can possibly present as a few diseases, but in itself, I think, correct me if I'm wrong, the doctors in the house, I think it's a disorder more than a disease.
Yeah, I think disease also has just this connotation that it's, you know, contagious or something that can be passed on, and it just doesn't have a positive, I guess. Not that disorder does, but disorder is, sounds a little bit more, I guess, correct.
And Noemi here says, do we need to ban the term sickler?
Oh, I hate that term.
Oh, definitely, yes, please.
Yeah.
Yeah, everyone hates that term. Hate that term completely.
I grew up in Nigeria.
Nigeria, right?
Yeah, where
so
there was
common. They refer
absolutely
to
no
people.
political correctness about
Honestly.
it. You were called a sickler.
Sickler.
You know, it was all
Okay. Let me ask you about that. I understand that, you know, maybe you find it like, I don't know how you find it, I would say offensive, but you don't like it, right? Obviously. So somebody who has like diabetes, you're going to say, oh, I'm a diabetic. And they've been saying it for years, right? So why is it that you don't want the word sickler? I just want to hear from the patient.
Sick in it, because the sickler, right, implies someone who's always sick, rather than the fact that you've got sickle cells. So that sick is sort of confused with, you know, people don't actually understand the condition. They just know, oh, yeah, that's someone who's always sick. So that's sickler thing, yeah, especially when people don't really know anything about the condition.
I know.
Yeah.
Okay, but in French.
Can I just add to that, please? Hi, everyone.
Okay.
Hi, everyone. My name's Fumi. So I personally hate the term sickler because it means that it kind of gives you the impression that you're defined by your disease. So I think going back to what we said earlier on, I'm a person first who happens to have sickle cell. Like similarly, if I had diabetes or, you know, I don't know, heart disease, I'm a person first. So that's why I personally don't like the term sickler.
Perfect. And yes, and Jenna put a comment there, and I was going to say that Jenna speaks French, just like myself. And in sub-Saharan countries, you know, there is a term, they call them drépanocytaires, which is the translation of sickler. And that's how they call them. And then even the people living with sickle cell disease themselves, that's how they call it. So I don't know if it's a language thing that, you know, the way it's said, it doesn't matter for French-speaking people. Actually, I don't know, but just so you know.
I got used to it, but I'm like a patient with sickle cell disease. So I'll say that je suis une patiente drépanocytaire because I'm not always feeling pain or I don't always have complications. So I'm just a patient. I mean, myself.
Okay.
I will say about that, there are people who are trying to reclaim the word. And so there are people who are trying to put it in a positive light. So there's this little, I think he's a 14-year-old boy who created a comic book called Adventures of the Sickler. And the Sickler is a superhero and he wears a cape and he saves the day. So I think there are people who are trying to put a positive spin on that word.
I think Vanessa had something to say. I think you've had your hand up for a bit. Sorry, I didn't realize. Over to you, Vanessa.
Oh, yeah, that's okay. When you're asking if we prefer to say sickle cell disease or disorder, I found when I was younger and I used the term disease, then people would be like, oh, is it contagious? Can I catch it? And it was automatically received negatively, regardless of whether they knew or didn't know about it. So over time, I converted to sickle cell anemia because it seemed that that was somehow more acceptable and didn't freak out people straight away. So then it gave me a chance to then to explain or educate if I needed to. And then also in terms of sickler, I've gotten used to hearing that term, and I try to not take it as a negative thing as best as possible, just for my own sort of sanity. But I do know that not just that it can offend people, but as others have said, it can be interpreted as being negative because of the sick part of it. I think that's always going to be a challenge.
Okay, thank you. Okay, thank you. Salvana, can we move to the next question? Because I think we are going to run out
Yeah,
of
we've got
time.
about 10 more minutes, maybe.
Okay, so I'm going to switch. There are two questions. One of them is going to be about what we're going through in this world, the COVID-19 pandemic. But before we get that, there's a more important issue for our community, and I would like to talk about that. So the next question is about racism. How do you think we can work together? And when we say we can work together here, the healthcare providers want to know with you, the community, with patients, to tackle the racism that exists, in a NHS. So,
or elsewhere.
The racism, stigmatization. Go ahead, Cassandra. Do you want to go first?
Yeah, that's a tough one, and I think that one can have a whole conversation and a whole panel on its own. The way I see it is people either don't know about sickle cell or they don't care. And so it's, to me, there'll always be racist. And so to me, policy is what makes more sense, enforcing that people do get good care wherever you are, and, consequences if patients are, receiving, mistreatment or malpractice from somebody that is racist. Because at this point, it's just like, it's not about changing a racist mind. It's just getting the care that you need, and at the end, the good care that you need at the end of the day, and making sure that's enforced. And that's how it feels like to me here in America, where, it's just rampant right now. So.
Yes, thank you. Yeah, before we move to the next one, I want to say that, when the GASDO, the Global Organization for Sickle Cell, was founded, one of, in the vision that we had, it was that, to ensure equitable access to optimal care, and treatment for all individuals living with sickle cell disease worldwide. And I think this is how we're going to eradicate any type of racism and stigmatization. Because whatever we do, we can put a lot of policies like in North America or in Europe, but when somebody in Africa and India doesn't even have access to the same type of care, we cannot even, begin to talk about, the same level of care. So yes, it's important, and we need to work on that first before we can change things for the community. Sola, do you want to go next?
I think Cindy and then Miriam wanted to say something. So Cindy first.
Okay. Yeah, I would like to react about that, because when we get married with my husband, I'd asked to my doctor if I can be tested for sickle cell disease, because my mother is from Spain and can be another syndrome very close to sickle cell. Mm-hmm. And my doctor respond me, no, it's okay, you're not black. And I laugh, and I said, and I explained to her that it's not a question of skin color, it's a question of gene. I don't know how to say it in English, but it's not the fact of the skin color. There is white people which have sickle cell disease, Chinese, Indian, I don't know, but I need to be tested before the wedding.
Yeah. And that's important. If we want to reduce the global incidence of this disease, every person that think they're at risk should be tested and should be provided the opportunity to be, especially when you ask for it and you say your background. So thanks for that. I think Miriam is next.
Yep. So I have a different experience. Well, the way I understood your question was exactly in that sense, because here in the UK, I can see a lot of people talking about it in terms of trying to separate from being a Black people disease, but very much focus as well that there is a large Black people community, and there is a high prevalence there. In Portugal, my experience is different, because although we do have large Black people communities, there are also many white Caucasian that have the disease as well, because there are like pockets in different areas, and over time, well, it has become a mixed thing. But my experience since I was a child is that every time I would go to hospital and say I have this, they would look at me, oh no, you don't, because you're white. Okay, it wasn't very nice to grow up hearing that. Things have changed a little bit, but here in the UK, which is more amazing, I've been here for 6 years. Not hematologists, but from other specialties where I go, many times they ask me, if I didn't read in your charts that you have sickle cell, I wouldn't believe it. One, because you're white, the other one, because you have a good appearance. That is so demoralizing. And that's not what you want to hear at all. So there is a lot of work that has to be done in both ways. So it is out there, and it can affect anyone. So there is a lot of work to do there.
Yeah, but let's put the focus specifically on now, if we have a conversation, physician to patient, how can we work better together? Because there is a lot of information here from the patient community saying, this is how I've been treated, this is how they responded to me. So it would be good to have like some ideas on how we can make things better, working together.
I like the idea of having, just these types of conversations with physicians, just having these open and honest conversations. I think that's the only way we move forward. And that's the only way you learn about my perspective and I learn about yours. So I think continuing the conversation and having these forums and having webinars and having racial training and all of the above, just to attack it on all fronts, just to make sure there is that understanding, because like everybody has said.
Cassandra, my worry is that the physicians that are going to engage with you are probably the physicians that already don't have a problem. and
it's like speaking to the choir, right?
Yeah. So how do you reach the physicians who don't think they have a problem, but they do?
No, so with my work with Sickle Cell 101, we talk to med students, we talk to residents, we talk to, just larger groups of physicians who need their like continuing education units and need, make these things mandatory so that they are aware that, this is a racial thing and to factor that all in.
Exactly. And exactly, somebody said education for all, and I believe in that. I think we have to educate everyone. We are talking today about the healthcare providers, but you're going to be very surprised to see that now people who have sickle cell disease are living longer lives because of all these treatment options. And some people are getting in trouble with the police. And you know what? Sometimes they don't know what is sickle cell. Yes, you can get in trouble, you have to face the law, but you have to be treated in a certain way because of the conditions. And if they don't, it can be really harmful for you. So it's very important that wherever you are as a patient group, you engage those group of people to educate them. You engage the teachers, somebody who has to drink a lot of water may require to go to the bathroom more often. If the child is shy, he won't do that. So all these people have to be, so education for all is the key here to move forward, And
adding something about the care that are given in the hospital. I think Cassandra said that some specialists or some doctors were just not interested in sickle cell disease, which is true. I mean, I've seen this in France or in other countries, but if they all receive education, they know properly how to take care of the patients. They don't have a choice whether they're interested or not. I mean, they have to do their job. That's it.
Exactly. And one of the solutions that, we thought about in my organization, because by the way, I'm the president of the Sickle Cell Disease Association of Canada. And what we were thinking, we said, all the healthcare providers, when you talk, from the nurse, to the physician, to the hematologist sometimes, so they're required to have a certain number of hours of training per year. So if your organization can put together, this course that, they have to go and read and then take, and then it will give them some credits per year. I think it's the best way to get them informed. They're going to have to go learn about sickle cell, learn more, even if they do not have sickle cell patients, but at least they know. And if they come across one, at least they're going to have that education there. So maybe that's one of the things that as patient group, as advocates, we can add into our programs to get things to be, to change moving forward. So
I think we've had a great suggestion from Noemi saying that we should produce some material together, but we need to think about how that can be realistically sort of done through the ASCAT or maybe other platforms that all the organizations that are represented here.
Yes.
Sola has just said that there is systemic racism in the UK as it relates to not being included under disability as well as a free medicine provision. That's absolutely true. So this is just obviously very, very specific to the United Kingdom, because everybody's healthcare services systems are different. But certainly in the United Kingdom, there are lots of other illnesses, maybe not as severe as sickle cell, which if you suffer from those conditions, you're automatically very easy to obtain, disability, benefits or free prescriptions. So for instance, I have a patient who has asthma and sickle cell, and his mother was able to obtain all sorts of support by using the asthma diagnosis rather than the sickle cell diagnosis. So it is a real tragedy, and there's been a lot of work done in the United Kingdom to get free prescriptions and so on, but unfortunately we're not quite there yet.
Yeah, exactly. And this is one of the things we've heard so many times, not only in the UK though, Sola, just so you know, everywhere in America, in Canada, I'm pretty sure in other places in Europe. And this is a reality, but we have to keep working, to get things to change. Okay, so we're going to move to the next question, because I know that this can be a whole webinar on its own, because there are so many things.
We've only got like 2 minutes, 2 or 3 minutes.
2 minutes. So the last question,
yeah,
we're going to put it there. So do you feel that you have enough information about the risk for you to personally, the risk to you personally if you contacted COVID-19, and if not, how could we address this as of today? Cassandra, go first.
That's a really good question. What's really been helpful are attending meetings like this. I think they started a database where they are following people who are living with sickle cell disease who have contracted COVID. The CDC in the US puts out statements like, fever, if you have sore throat and all that. But what that data showed was that most people with sickle cell disease who contracted COVID, the symptom that was prominent was a crisis. And so now I know if I'm going through a crisis, then that might be COVID-19 as opposed to the generic stuff that is being put out. So I would just, no, I don't think, and I can speak for myself, I don't feel like I'm informed. I feel like we just need more information. We need more research on that, but just, I will co-sign on the databases so that we can continue to collect information and we can get a better understanding of, COVID-19 and sickle cell disease.
Absolutely. You're absolutely
and can I just add something as well? Yes. I think also because sickle cell presents with so many different complications, like I was asking at the other panel. My complication is lung-based, lung-related mostly. Some other person, it could be strokes or other things. And so as it affects you with sickle cell and you with your specific complication as well, there's absolutely no information about it. And it's a lot of, it's more like just wait and see how we, if you do catch COVID, wait and see how you go. Do you recover from it? Are you going to be a statistic? It's just, and it's really, really anxiety inducing when you think about how you can't be sure what the prognosis will be for you if you do contract it. And it makes you have to take really, really drastic decisions. Like personally, it's affected my life so much that I've had to sit out this year because I was going to go on to a program that involves me going into secondary schools. And when I started to see how the cases started to rise, I just thought, no. And people were being advised to work from home if possible. I thought, okay, if ordinary people would probably recover quickly from COVID, I've been advised to stay home if they can, then I think I'd have to make that personal decision to, postpone going on my course, because I'm not going to want to be exposed to people if I'm not sure if I will get over COVID when I do catch it, if I do catch it.
That was a wise decision. Anybody else wants to comment on this? I think we are out of time, right, Sorbana? But we did good. We were able to.
We did very well, and great comparing skills of Viva, I have to say.
Thank you everyone today. Thank you, Cassandra. Thank you for your input. Thank you for honestly sharing your life experiences with us today. And it was really a great honor for me to be here. This is my first time with ASCAT, and I hope to be back another time. So Vanna, I will let you finish.
Oh, thank you. It was really good.